And Western medicine, they're going to say, and I've heard it way too many times from patients going to the OB-GYN, it's okay that your libido is going down. It's okay that you don't feel as good. It's normal. It's part of menopause. I'll be damned if you're going to tell me that that's normal. We don't have to be normal. What is normal in today's society is chronic illness, high blood pressure, low thyroid. I don't feel good. Pre-diabetes. That's quote unquote normal in today's society. People don't have to be normal. People can feel amazing forever.
This is Meredith for Real, the Curious Introvert, and I'm Meredith. I explore the questions people think but don't ask out loud, either because they're taboo or thanks to cultural hypnosis. My mission, and yours if you choose to accept it, is to inspire curiosity by exploring the nuance and paradox of our world. Each episode is different, so bring your ADD and your earbuds and have a look around. Hey, Curiositors, it's me, Meredith. Thank you so much for pressing play today. You told me that you wanted more episodes about health and wellness, and today is just that. My guest paints the picture of the connection between your hormones and your brain. We talk about depression, anxiety, ADHD, focus, motivation, all things you think of as mindset and outlook, but they're totally connected to hormones. And Alzheimer's. We talked about Alzheimer's. He had some really interesting things to say about that too. Hormones is a fascinating topic. If you want to hear more from him after this episode, be sure to follow me on Instagram. It's at Meredith for Real to join in on our Instagram live for a segment that I call Curiouser and Curiouser. And if you end up liking this episode, you'll also like the one I did with the food addiction specialist about how processed food might be impacting your brain. It's episode 76. And if you're new here, welcome. Around here, we press play to get curious, disrupt that algorithm, and grow into better humans. We talk about everything from marijuana to mental health. So bring your ADD and your earbuds and have a look around. There is no specific order to listen to episodes. They say getting older isn't for the faint of heart. It's true. Everyone I talk to is trying to figure out how they should feel. A task that's hard when you suspect you could feel better, but your doctor tells you your labs are within range, and then it's all a part of getting older. And the biggest aging fear, its impact on your brain. But what if your brain is trying to leave you clues in your labs? My next guest is a physician's assistant who spent the first 10 years of his practice holding traditional appointments. If the patient's hormones were within range, he didn't recommend any interventions, even if they didn't feel good. He's since shifted to working with patients instead of with the system, helping both men and women navigate to optimum health and vitality. Today, he's going to help us connect the dots between our hormones and our head. Vitality campaigner, Army veteran, wellness Sherpa, Tim Anderson. Thanks for being here.
Hey, thanks, Mary, for having me. I really appreciate it.
I think in Western culture, we have this temptation to think of the body parts as separate. Definitely the head is separate from, the brain is separate from the body, and hormones and sex hormones are separate from the consequences of the body. So can you kind of help us understand what the consequences are of imbalanced hormones on brain health?
Yeah, you're dead on. Everybody tries to separate everything and talk about each individual section, part, hormone, organ separately. The problem is they all affect and function dependently on each other. And so that's the hard part of this. And so hormones absolutely impact our brain health. Testosterone can impact anxiety, emotional up, down. There's links to Alzheimer's. Progesterone, as it fails in both men and women, anxiety, poor sleep. You're just not as calm, as cool. Estrogen absolutely can impact women more so than men, definitely from an Alzheimer's perspective as well. The connection, and it doesn't just stop there. There's melatonin, there's GABA. There's so many hormones that we have to look at together. And like you said, It's not the normal values. It's what's normal for the individual person.
I'd like to touch on the depression part because depression is said to be the leading cause of disability worldwide. Can you unpack that a little bit in more detail of how hormones and depression are either corresponding or is it causative?
So that's a great question, and it's a hard question because you're looking at testosterone, for example. You're looking at energy, libido, focus, drive, motivation, memory, depression. It can be monotherapy for depression. There are so many people that we have treated over the last 8-9 years just with testosterone therapy who have been able to come off of antidepressant medications, anti-anxiety medications. They just feel different. But it's not just the testosterone piece. That's the problem. It's a combination of all the hormones. And if you're only going, oh, your testosterone's normal, it can't be testosterone. Well, what if the testosterone is a little bit low for that person? Again, it goes back to what's normal, what's not normal for the individual person. If the progesterone is off a little bit and they're not sleeping well, and of course, if you're not sleeping, you're going to have depression. You're not going to feel good. If your estrogen is off, estrogen can help with depression. That's the hard part, is it's the combination. It's not the individual.
I think that's the hard part for people is knowing that it is a combination, if they can even grasp that, first of all, because it's a big concept, right? No one really gives us a manual to our bodies, which is unfortunate. I feel like health class in high school should have been like how to live in your body. But it's even harder when we go to our doctors and we've got 15 minutes with them and we feel like, I don't know, whenever I go to the doctor, which admittedly is not often, I feel like I have to prepare for it as though it were an exam. Like, okay, testosterone does this. It might be okay. And then that commercial said I could ask my doctor about such and such. Is it possible to even receive support for your hormone health as it relates to all of your, optimal function through your traditional doctor in a 15-minute appointment setting?
So hard. I'm going to say the answer is no, and it's multifaceted. So, going in the Wayback Machine, what is the purpose of Western medicine? Is Western medicine here to make us healthy and well? I would argue that the answer is no, because if Western medicine makes you healthy and well, Western medicine collapses on itself. It needs you to come for labs. It needs you to be on prescription medication. It needs you to come for office visits for testing, because it's not your copays so much that they're really looking for. It's the ability to bill the insurance is what they're looking for. And if you don't show up for a visit, they don't get to bill you. And so that's the problem. So the answer is no. I'm going to say no, only because they're looking at numbers. Again, for the first 10 years, like you said, I did traditional medicine. And I was that person looking at numbers. Oh, your numbers are normal, but I have depression. I don't feel good. My hair's off. My metabolism's off. I have low energy. Oh, here's an antidepressant. I didn't look at their thyroid the right way. I didn't look at their testosterone the right way. I was looking at the normal ranges when I should have been going, testosterone for a woman. I have one of my labs. A normal testosterone range was 0 to 60. How is 0 a normal range ever?
Oh, okay. So you're saying that was presented as a normal range to have 0 testosterone?
On the lab, 0 to 60 was normal.
Okay. Maybe this would be a good time to talk about testosterone in women, because I think when women think about testosterone, right, we're thinking about female bodybuilders, we're thinking about men, we're thinking about maybe people that are like transitioning into male. Like, we're not thinking about our brain health. We're not thinking about depression. We're not thinking about why we have low energy and can't remember things. So connect the dots for us on being a woman and needing testosterone higher than 0, please.
Yeah. And so absolutely, testosterone, just like progesterone, everybody's like, oh, progesterone, that's a female hormone. Absolutely not. It's a male hormone too. Just like testosterone isn't only a male hormone, it is absolutely a female hormone. I would argue it's probably one of the most important female hormones. I always tell my girls, think of it as your mojo hormone. Austin Powers, absolutely, it's your mojo. And it's energy, it's libido, it's focus, it's drive, it's motivation, it's memory, it's a less emotional up down, it's a lean muscle mass, it's anabolic, it's less inflammation, monotherapy for depression. Absolutely. And Western medicine, they're going to say, and I've heard it way too many times from patients going to the OB-GYN, it's okay that your libido is going down. It's okay that you don't feel as good. It's normal. It's part of menopause. I'll be damned if you're going to tell me that that's normal. We don't have to be normal. What is normal in today's society is chronic illness, high blood pressure, low thyroid. I don't feel good. Pre-diabetes. That's quote unquote normal in today's society. People don't have to be normal. People can feel amazing forever. And yes, is there a risk? Can you get cancer? Not with hormones, but can you get cancer? Yes. Are hormones going to prevent that? No, but it's going to make your body healthy so you can fight. It's going to keep your brain healthy. It's going to keep you sleeping. It's going to keep you motivated.
When you're talking about cancer, I think I'm missing a reference here that I feel like you're giving me credit for pre-understanding. Are people accusing hormone therapy with cancer development or something?
Yeah, back in the early 2000s, there was something called the Women's Health Initiative, and it looked at horse equine estrogen, not bioidentical, and it looked at progestin as treatment for women, and it said they gave them increased breast and uterine cell cancers. And so that's where a lot of the crux of traditional Western medicine, don't do hormones, they're bad for you, don't do them. Well, there's actually a bigger study called the French cohort study, who had different arms of hormone replacement therapy. One of the arms was a bioidentical progesterone and a bioidentical estradiol, and it actually showed reduced risk of breast and uterine cell cancer in that arm. And so there's so many benefits of hormone replacement therapy. People just cardiovascular, again, the depression piece, insulin, like my type 2 diabetics have reduced need, some of them have reduced need for insulin because their insulin's working better with elevated testosterone levels, so they have to take their meds down.
Oh man, that's so interesting. It is a real mind shift to start to think of the body as a whole thing and not as separate systems that are insular from each other, like the neck bone's connected to the whatever bone, singing that song like you're a little kid again. I want to come back to labs in a second, but before we leave the territory of symptoms, is there a causation or correlation between adult ADHD and hormone imbalance?
There might be a correlation, but I don't know. It could be a causation. There isn't a lot of good studies on that. That's part of the problem. And there's not a lot of good studies on some of this, and a lot of it is anecdotal. And it's you treat a bunch of people, we have hormones in our bodies. And so they talk about prostate cancer, for example, in men. Well, if men you give testosterone replacement to men, and they say it makes them have prostate cancer. Well, if you have a lower level, and I'm giving you some testosterone, well, you look at who has highest levels of testosterone. Men in their early 20s. Well, that's not who gets prostate cancer. And so again, it's all looking at, you have to understand the direction and how things work. And so for the ADHD part, less emotional up down, better focus, better drive, better memory. Yes. Do I see all of my ADHD people get better with testosterone therapy? No. But again, it's the combination. With progesterone helps them calm, cool, and collected. So a little bit more chill, a little bit more calm. They're not quite as ampy everywhere, if that makes sense. And so it's dietary based too. Remember, this isn't just about the hormones. And so I always that's one of the points I make with my patients. Hormones are a piece of the puzzle. but it's only a piece. You have to look at all the pieces: iron, thyroid, sleep, stress. It's everything together. And if you only fix one piece of the puzzle, you'll be better, but you're probably never going to be amazing. And so that's the hard part, is when you're trying to study these things, looking for big cofactors and, things that are messing with your study. How do you account for everything? Because everything is really what needs to be accounted for. You can't. And so you just have to do good referencing. You have to have good questions of your patients. How are your symptoms? And this is part of one of the reasons why it can't happen in traditional medicine, is you only have 15 minutes. How do you talk about the labs and the history and ask them about how much better they are in 15 minutes?
No, you can't. I heard someone say that, I forget what specifically she was talking about, but this sentence has stayed with me since I heard it. She said, "I am my own primary care provider." And I was like, whoa, that's so true, because we can argue until we're blue in the face about the studies or lack of studies, the thoroughness, the quality of the study. But at the end of the day, we all have to live in our own bodies. And so by increasing that body-mind connectedness, which sounds so hippie and so yoga, but it's really quite basic. And I think we've just been trained as a society to outsource our wellness to these short appointments. And so it's kind of like, okay, if that's not working for you, let's retrain ourselves. And I'm all for it. So birth control question. How does birth control affect potentially our brain health as women?
So birth control absolutely will decrease production of estrogen and progesterone. It decreases your B vitamin pathway, especially B6 pathway. And so we find a lot of our women are deficient in the B vitamins with birth control. They're synthetic. They're not bioidentical. And so, yes, I have this conversation a lot with a lot of my girls, and they're like, well, I don't want a baby. I'm like, that's fine. Yes, we don't want you to have a baby. And that's one of the risks with testosterone, is it's pregnancy category X. So it's unknown, and there is belief that it can cause birth defects. So that's one of the things that we talk about with women who are of childbearing age. Anybody who could become pregnant or wants to become pregnant, we don't put them on testosterone because of the risk to the baby. So we always tell them, I need you to have some sort of contraceptive until you're ready to start having children, and then we pull you off. So for contraception, I personally like IUDs, either a copper or Mirena. Those are going to be the most natural types of IUDs. Now, not every type of birth control is an option for every person, because of, you may have some anatomical changes that, pain. I mean, that's the hard part of this. And so if you're going to be on some type of oral contraceptive, we don't want you to be on it any longer than you absolutely have to be. And if you can potentially use an IUD, that's my recommendation. But again, have a conversation with your OB/GYN and find out what all your options are, not just here's an oral contraceptive. Ask them to give you the pros and cons of IUDs.
You should have seen my doctor's face when I asked about the pros and cons of any medicine they suggest. They're like, what do you mean? So that makes me laugh, because I just understand the struggle so much, especially for women, of, asking any question back to the doctor regarding a recommendation. So it can be a real struggle, but thankfully there's people like you out there. So I've heard you say in other interviews that it's important to establish a baseline at some point to kind of keep an eye on what is normal for you and connect that baseline lab set of numbers to how you're feeling. At what age is it appropriate for people to get those baseline numbers on their hormones?
Oh my gosh. So I'm 55. I wish I would have had a baseline in my 20s. I was a college athlete, played basketball. I played all the sports in high school. I was never big and bulky, would eat, would go to the weight room. I was never big and bulky. And I was always, man, I'm not as big as everybody else. So where was my testosterone level? I don't know because I never checked, because you never check things when you're healthy. I would have, so I treat people in their late teens. I have a couple of college kids I treat. I would absolutely in their 20s, as soon as you can. I mean, we're all older now. We can't go back and get them. I would get a baseline as soon as you can get a baseline, because that's just a starting point. And if you feel great and you're not interested in doing anything, then don't do anything. That's the beauty of this, is you don't have to. But in 2, 3, 4, 5 years, let's say, for example, your testosterone for a girl, let's say she's at 100. And in 3 years, she's at 20. And all of a sudden, her libido's down, her energy's down, focus, drive, motivation, memory, all those are down. Oh, ma'am, you're okay. Your numbers are normal. 3 years ago, I was at 100 and I felt amazing. Now I'm 20. Oh, well, okay, maybe we put you on something. Let's say we put her on something, get her back up to 100, all of a sudden she's amazing. So that 100 for her is normal for her. And so that's the beauty of having that baseline, just getting it established as quickly as possible.
We're going to take a quick break to appreciate those who support the show. When we come back, you'll hear what mineral everyone is low on, the connection between Alzheimer's and hormones, and the difference between hormones for vanity versus for optimal health. If you ever wonder where I find guests for the show, the answer is it varies a lot. And since it's something that gets asked a lot, I started including the backstory of each episode in my Monday emails. And then on Saturday, I share cliff notes and clickable links in case what you heard was so good you wish you could have taken notes. If you want to be included, text REAL to 66866 if you're in the US, or go to meredithforreal.com if you're elsewhere. If you're listening north of the state of Georgia, mosquitoes are not top of mind right now. But if you're in the Florida Panhandle or Gulf Coast of Alabama, you're already dusting off your grill and citronella candles. Make life easy for future you and get your property scheduled for a mosquito treatment with Insect. I've been using them since 2019 and they continue to impress me. They guarantee their work and pollinators are always top of mind. Check them out at ensec.net. If you watch the show on YouTube, then you see the beautiful backdrop of Trader John's, the exhibit where I record the show inside the Pensacola Museum of History. This is just one museum under the umbrella of the UWF Historic Trust. If you're planning a trip to Pensacola and need an indoor activity option, pick up a ticket. It's good for a whole week. Get your tickets in person so you can show the agent one of my emails and get $2 off an adult ticket. Now back to the show. Remember to stay till the end where I give you a sneak peek of next week's episode. Is it ever appropriate to get a baseline on teenagers if they're having mental health problems or maybe like painful periods that are causing them to miss school?
So it's hard because, again, everybody's going through puberty and levels are kind of rising and falling at a different time. But there are absolutely things that you can do to help with painful cycles. Magnesium and progesterone are kind of the two biggest things that I look at for my girls as far as menstrual migraines, types of things. I have a couple of my patients who every month they were missing 3 days of work right around their cycle, every month. So they came in, they saw us, numbers were quote unquote normal. We put them on a little low dose progesterone. We put them on some magnesium, which is everybody's deficient. And within the first month, one of my girls, she had a slight headache, didn't miss any work, and has now not had a headache in 3 years and has not missed work.
So what's the difference between a doctor giving a woman birth control for that same reason? She's like, oh, I have painful periods, they're irregular, they're uncomfortable, etc. The doctor gives you birth control. You are prescribing a hormone. I can just hear a listener now going, wait a minute, isn't this the same? Why do I have to go to a fancy doctor when I can just get some birth control delivered to my mailbox?
Because it's not bioidentical. You're using synthetic chemicals. You're not using yourself. And magnesium is a supplement that everybody's deficient in. Helps with anxiety, stress, sleep, vascular stability, smooth muscle relaxation, helps with cardiac rhythms, helps with nerve conduction, helps with bowel movements. Anybody who's having any constipation, leg cramps, muscle spasms, or restless leg syndrome at night, I will guarantee there's some degree of magnesium deficiency. And again, it's a supplement. You're never going to get that from your traditional medicine doctor because they can't make money on it.
That's so true. I experienced years of very painful Charlie horses since probably puberty on, maybe even before then. And I never knew to take magnesium until even just recently. I'm getting success with magnesium glycinate. For the average listener confused by the many options in their vitamin shop, is that what they should go for first, or do you recommend a magnesium blend?
No, I like glycinate better. The reason that glycinate's better is glycinate goes throughout the whole body and helps with all those things I just mentioned. The other one that you'll find a lot of is magnesium citrate, and that's what a lot of people will use when they're constipated. The problem with magnesium citrate is that it goes directly to the bowels, and you're going to get loose bowel movements before you actually get the dose high enough to make a difference in the Charlie horses and the rest of it.
Okay. Here's a left field question that I got from someone recently is, does a vasectomy change your hormones?
So it changes sperm counts. There's questions on whether it changes testosterone, but I do not believe that it's going to impact your testosterone levels enough in a man to make a difference. The problem is most men, when they go to get a vasectomy, are already in their mid to late 30s, and they're already getting ready to approach andropause anyways, menopause, andropause. And so their levels are starting to go down, and people are saying, oh, it's because of the vasectomy. Well, first, did you have a baseline? Where were you? And if you never had a baseline lab, you don't know where you are currently in reference to that. And so I don't think it's because of the vasectomy. I think it's more just timing.
Can you explain andropause? Because that is a totally new term for me. The idea that men's hormones change at a certain age, or that they change at all outside of puberty, is kind of new information.
Oh, yeah. So menopause, I mean, females are always familiar with menopause. Progesterone, estrogen, testosterone, those are the big three kind of sex hormones. Absolutely. Andropause, same sort of concept. It's you lose progesterone. I've been on progesterone for over 7 years for sleep. Everybody's like, that's a female hormone. Absolutely not. Progesterone is used in, post-stroke, helps with inflammatory, reduces inflammation in the brain, stimulates bone building, helps with anxiety. I use progesterone in the daytime for some of my patients to reduce daytime anxiety instead of a Xanax or an Ativan, a bioidentical hormone instead of a chemical. And so andropause, all it is reduction in sex hormones, and it comes with age.
That is so interesting that you said that let me make sure I get that right, progesterone reduces inflammation in the brain. And isn't that what people tend to think is the root cause of Alzheimer's, is inflammation of the brain?
It's inflammation, but it's also testosterone and estrogen being low are also, we think, root causes too.
Really?
And so that's the problem. Again, like you said, it's not just one thing, it's the combination of things.
This is so interesting because, okay, how do you do this with clients? I mean, maybe they just find you, right, because of what you do. But how do you convince yourself as a potential patient, I guess, to make the mental shift from these sorts of things being more, I don't know, I'm going to call them vanity hormones. Does that make sense? Like a guy who wants to bulk up, he wants testosterone. And so we put that in the vanity category, not in the health vitality. It's not necessary. It's not a necessity. And then for women, menopause is uncomfortable. I just need to be more comfortable. Maybe I could get some bioidentical hormones. Do you kind of see what I'm saying? This is kind of a poorly worded question, but I think we put this sort of support as an extra thing. Like, okay, yeah, when I have my life together, when I have time, if things get really bad, then maybe I'll go this direction. But it's not in any way the level of importance of, say, taking a statin every day.
Right. And again, that's because that's the message that is put out through traditional medicine is it's okay to not feel as good. It's okay to have lower libido. It's okay if your energy isn't as good. It's okay if you have hot flashes. It's menopause. It'll pass. And that's not true. You don't have to feel that way. One of the things with hormones, especially estrogen, is when a woman's estrogen goes lower, their cardiovascular risk approaches that of a man because estrogen is so cardioprotective. And so that why wouldn't you want to maintain that level of estrogen to maintain that protection? Brain health. Estrogen gives my girls less mushy brains, so to speak. And so it's definitely a paradigm shift when you come and you look and you seek out a traditional holistic hormone replacement person. Usually that has to do with frustration. And you're frustrated. You've done everything, and nothing's getting better. And a lot of times it's a desperation visit. And then when we sit down and we go over all the quote unquote normal numbers, like testosterone 0 to 60, and I tell them, oh, you're at 12, but that's not where I want you. And we talk about symptoms and we talk about where their numbers are and they're not normal. And we talk about, let's treat your symptoms. Again, it's just the shift. Let's treat your symptoms, not your numbers. But it is the initial visits, a lot of them are desperation.
Interesting. Yeah.
It's sad. And it's so sad.
It is sad. Yeah. Because you want people prior to that so you can really help them with vitality and not have to spend as much time on the corrective stage, right?
I have people who so many people. How come I didn't find you 5, 10, 15 years ago? I've been struggling with this energy, depression, libido. You've changed my life. You've changed my relationships. You've saved my life. You've saved my marriage. You've saved my job. It's so amazing. And what a bioidentical, it's something we have in us. It's a hormone we own. We have it. All I'm doing is giving you something that maybe you never produced enough of ever. That's why you've always had problems with depression or sleep or low libido. And I'm giving you something that maybe you never produced enough of or are not producing enough of, and it's life-changing.
That is so fascinating. I never even thought about someone who struggled with something forever to check hormones. I wonder how many people are missing this, because I'm seeing faces in my mind's eye of people that have struggled with depression for almost their whole lives, or struggled with or are increasingly struggling with memory and kind of laughing it off, struggling with energy levels. And yeah, it's so easy to get sucked into the narrative of, oh, well, it's just because I'm getting older. And, you don't want to be in denial, but it's like you also kind of want to listen to your body and not just accept that the most of the population in the United States, I think it's almost 80% is metabolically unwell. So it's probably not like a good move for us to compare ourselves to the majority of the US population, whether it via popular culture and things that, oh, it's just because, I literally was watching Working Moms the other day, and she was like dropping things and running into stuff and forgetting things. And she went to the doctor in this sitcom episode, and the doctor said, I see this a lot in women your age, just trying to do everything. And she was in the episode, but it made me think, that's a little dismissive.
Right. And that's frustrating. When I know people who, like you said, have had depression or memory issues, they started on testosterone therapy, all of a sudden their memory is back on point. And they do a delivery method with pellets. It's just one of the delivery methods for testosterone. And this particular person, every time, a female, every 3 to 4 months for pellets, about 4 months into her pellets, her memory starts to get a little shaky again because her testosterone level is starting to drop again. Then when she gets her pellets put back in, usually within 1 or 2 weeks, her memory is back on point and everything's awesome again. So to your point of in the past or people who have always had a history of something, I absolutely believe there's a correlation to that. But again, Western medicine, they have no interest in looking for the cause. All they want to do is put a Band-Aid on you.
Okay, what are pellets? I'm kind of afraid to ask. I don't know what that is.
So there's different delivery options for testosterone therapy. There's no oral medications that I use. I use creams, injections, or pellets. Pellets are like little Tic Tacs. They're compressed testosterone powder, and you implant them in the gluteal region. You get numbed up with like lidocaine, like if you're going to get the dentist to get a root canal or something, and you don't feel anything except pressure, and you put it just a little Tic Tac in the subcutaneous fat above the muscle in the gluteal region, and they sit there for 3 to 4 months for a girl, 5 to 6 months for a guy. You don't have to do a weekly injection, a daily cream. It's just a delivery option. They work well. They're not for everybody because some people are like, you're going to put that in me? Absolutely not. I want something different. Okay, cool. That's why we have different things. But there are people who travel a lot and they don't want to carry injections internationally, or they're like, I'm not going to do a cream every day. I'm going to absolutely forget. And if you're not doing it consistently, you're not going to get the benefit of it. And so again, this is why you have different delivery options and you have conversations. You have to understand your patients and you have to understand what their life looks like. And if they're crazy busy or they have some little kids, you don't want to give them a cream that could rub off on the little kid. And so again, it's just understanding your patient and just having conversations.
Okay. So I would love for you to share how people work with you, who you're allowed to work with, because you're in Florida. But before we do that, is there anything else that you want to add to our conversation about brain health and hormones that you feel like we might have missed?
So the big thing for me is you have to look at all of it. And if you're not looking at all of it, you're gonna miss something. And so, like vitamin D, everybody knows the benefit of vitamin D, especially in COVID. Vitamin D can help with depression. Vitamin D is a hormone, not a vitamin. And you should have a solid level of vitamin D. I had some 30 to 100 is normal. I like my patients in the 70 to 90 range. 3 years into COVID last week, I had somebody whose vitamin D was 8. 3 years into COVID. And we know it's protective. Cancer, viral, depression. How is that even allowed? And again, it's frustrating because it's just a simple test that any provider can order.
Yeah. Yeah, that's so true. Okay, so how can people take action on this information? How can they work with you, and who's allowed to work with you since you're in the state of Florida?
Yeah, so we are actually in the process of rolling out a national program where we're going to be training docs, nurse practitioners, PAs to give us better coverage throughout the U.S. And so we have just launched. We have somebody who's coming online soon in Nevada. We have somebody who's looking in Austin, Texas. And so the way people can work with us now is they can look at our website, healthmatrix.com, and we can do a free 15-minute consultation with anybody who reaches out. And we can order labs. We can look at supplements. We can make recommendations. And the goal is then hopefully by that time and as we grow, we can connect you with the provider who is like-minded to us, that's trained in our protocol, where we can get consistent results. Again, not everyone is going to have the same results because we're all unique individuals. And it's not just, hey, let me give you something. I always tell my patients, it's not, hey, shove this in your mouth, rub this on your belly, inject this here, drink this purple drink. You have to participate. You have to sleep. You have to stress manage. You have to hydrate. You have to work on you because you're a part of the puzzle. It's not just the hormones. And the other way they can reach us is through our Instagram, Tim_Anderson PA, and we're happy to answer questions. We're a resource. We love that we can have conversations. We can give you information. You don't have to do anything. I visit all the time with patients. They'll spend an hour with me. Like, I'm not sure I want to do anything. But they're so grateful because they're like, nobody has ever gone over my labs like this. They're like, I understand. I have people tell me, I have spent more time with you understanding my labs than I have in the 40 years I've been alive going to the doctor.
Isn't that crazy?
Because like you said, it's the 5-minute visit. What are you accomplishing?
It's so crazy. Well, I hope that if nothing else, this inspires people to make more of a connection between their mind and their body and not accept those canned answers that they're getting that aren't getting them to the level of health that they want. So thank you so much. This has been really good. I really appreciate it.
Hey, thank you so much for having me. And I look forward, if you guys have any questions, please reach out.
Will do. Thanks for listening. Did you think of someone you know while you listened? Help me grow the show by sharing this episode with that person. And if you liked this episode, you might also like the one I did with the food addiction specialist about how processed food may be impacting your brain. It's episode 76. Stay tuned next week when I talk with an expert on how to meditate with ADHD.